anybody needs reminding of what a critical time we're facing in the leisure industry.
And this is as of 2 weeks ago. We're just running the figures to double check the accuracy. The green line is how the sector is performing, exactly as we thought it was going to perform. I'm not saying that that is necessarily a good thing, but the key area is that this data is the reality of how we're performing, and how can we use this to understand the changes that we might need to accommodate moving forward.
Our partners want to be assured. They want to ensure that they're dealing with qualified, experienced and competent people. And we, you and I, must do everything we can to improve ourselves and prove our competence and experience. We're working, if we want to work with health individuals, we're working with doctors, we're working with nurses, we're working with public health experts who've been doing this all their lives, and they've been educated and trained to work in these themes. A course on a weekend is not going to cut it.
So one of the focuses here is around wanting to address inequalities. We are, I guess, very, very keen on the proportionate universalism principle. So again, that ties in nicely with where Carl was talking about earlier. And I guess, yeah, we recognise that some universal support is needed, but we also recognise that there are some people and some places that need more intensive support. And I think we want to unashamedly focus on those.
This presentation was really about us bringing 2 sites back in-house, and the decision was made pre-COVID, etc. So there are a few caveats, and I don't apologise for mentioning COVID, because it did impact quite considerably on what we did.
But we have got some practical examples of how these kind of statistics have been leveraged for positive social returns. So housing associations, as an example, they regularly invest into physical activity programmes in their local communities. They see physical activity as a great way to get residents out and about in the community, engaging with other people in informal, friendly settings. And participation in the community is a really important way to tackle social isolation and create cohesion between different demographics. Research has actually shown that happier housing residents are less likely to complain about housing services in their environment. Now, granted, that is not possible whilst our swimming pools are closed, but it's certainly food for thought for when they do reopen.
It's always been a balance that we've needed to strike in terms of our commercial objectives to balance the books and deliver a relatively small surplus against our charitable objectives and our social inclusion objectives, which obviously the commercial element of our operation funds our socially inclusive, charitable and partnership working, and we've inevitably had to shift that focus back, and we are now having to look at our commercially resilient programs and activities taking a priority, which means we are less able and in some instances unable to subsidise some of these socially inclusive and partnership activities that we've sort of built up again over many years.
These challenging times, you know, please everybody keep safe and well, and hope to obviously see you virtually and unvirtually in the very near future.